Hey folks, my name is Jessica Mashkovich, and this is One Take with Jess. Today, my guest is Ritu Khullar. She is a pediatrician from Goldstar Pediatrics in Colts Neck, New Jersey. Thank you so much for being here with us.
Absolutely. My pleasure for being here, Jess. Thanks for having me again.
Yeah, this episode, as people may recall who listened to the podcast, you were on about a month ago or 3 weeks
Yes.
ago, where we talked about kids' health, everything from COVID to fitness, exercise, mental health,
Yes.
marijuana. We covered a lot.
Everything. Yes.
But now we're here for this short period of time that you have available for me. Thank you again for carving it out.
You're welcome.
To talk about the heating up of COVID. I mean, you're seeing it flooding into your office, and I'm seeing it all around me with, close friends, family, relatives. So yeah, let's talk about what people need to do, can do, and how to act. We talked about it in concept, but now that like rubber meets road on this one, we got to get going in a particular direction, and I don't think anyone knows where to go and what to do.
Yeah. So first thing I'll start off with, if you're there's two subjects that we can talk about here. One is when do you want to go seek the advice of a doctor or go see your doctor? And so you want to look out for symptoms kind of similar to the flu, where you're having fevers, you're having body aches. There are some people who have had lack of smell or had issues with not being able to taste food. Some patients who have coughing or reactive airway disease or asthma may also experience some chest pain or shortness of breath, coughing. And then there's some patients who just experience a runny nose. So there's a huge variety of the symptoms that you could see with COVID. A lot of patients have been calling a little anxious on the first day of the fever, the first temperature that they take. Doctor, what do? I have a temperature. My kid has a temperature of 102, 101. What should I do? Very similar to other viruses. I always tell patients, first of all, we want to make sure that you're taking the temperature accurately. For kids, if they're younger than a particular age, usually under the age of 2, I recommend taking rectal temperature. So if you've taken, on frontal, or if you're taken under the arm, if you come to the ER, we're going to be taking a rectal temperature to get the most accurate temperature for a child under that age. That's the first part, because if you don't give me...
I'm sorry, I'm just going to stop you right there. Rectal thermometers, they are special rectal thermometers. They're not the ones that you stick in your ear.
So
right?
Yeah, so they're not the ones you stick in the ears. They're the very simple rectal thermometers that you can get at any pharmacy, any local store near you, and make sure you label it and keep it aside that you would have for the baby. And you put the silver portion in, you kind of, you could put a little lubricant at the end of it, put the silver tip in, and in a couple of seconds, you'll get a reading of the temperature for the baby or for the child.
Okay, I'm sorry, we had to take a break on that because rectal temperatures haven't been really talked about in like the world since 1970. And if the thermometer breaks, do not touch it, do not near it. It's got mercury in there, and that's very dangerous to you. So you can look that up on how to clean up a broken real glass thermometer.
Right. So with rectal temperature, that's what you do. But if you take a temperature, always make sure, you take it and you take it again after 10 minutes. Because a lot of patients will call, they get initial temperature 100.4, 100.5. I have a temperature, but what if your body temperature was running higher? What if the heat was on a little higher? What if you were running around outside, the jacket was on, the sweater was bundled too tight? So you want to make sure that you take the temperature, but you want to retake it again when you're completely comfortable, cool. You've taken off any heavy clothing to make sure that really is the temperature that you're getting. A lot of patients say, when I take the frontal temperature, I get one reading on one side, another reading on the other side, which can happen sometimes with the fluctuation. So you want to take 2 readings, and you can take the average of both to kind of get the temperature that we're looking for. So that's first and foremost. Make sure you truly have a temperature before getting anxious or, asking, okay, what are we going to do from here? You want to treat it very similarly to other viruses. At this time of the year, we're in December, you have other viruses that are out there. So you can have influenza virus, you can have rhinovirus, you can have other strains or types of coronavirus that have been out for a long time. So it could be just one of the viruses that you see around the winter time or around when the months get colder. So I always tell parents that if that's what happens on the first 24 hours, you're going to give Tylenol, Motrin if all they're having is fever and no other symptoms that they need to rush into the office for.
Okay. What
So
about the
within
Tylenol versus Advil thing with COVID?
Yeah, so a lot of, I feel like that has not been proven. There
Okay.
was one study that they discussed it, but then it was dismissed after that. And there has not been any mention about not using Motrin or ibuprofen. So we've never seen anything about that, no articles and no research-based evidence proving that.
Okay.
So
And
there's
it's
not enough
interesting
data.
in the medical community when my daughter went for her COVID test and came
Yeah.
up positive.
Yeah.
We asked about Advil versus Tylenol, and the medical professional said, stay away from Advil because it thins your blood. Stick with Tylenol. So I don't know where she got that from,
Yeah.
but I was like, okay, I thought all that Advil Tylenol was debunked, but I guess just, I mean, it's weird
Which is
what people say. And
right, exactly. So you have to be careful. A lot of people have to be careful with how they're conveying the information. After a certain amount of time, yes, Motrin and anti-inflammatories can cause the blood to thin, but that's not a concern or a worry related to COVID.
right.
In fact, one of the things you hear with COVID is that you may get some, blood clots or, things of that situation. So if that's the case, why would that be a problem?
I know
Plus,
that sounds like it would be in your favor, actually.
it
Yeah.
would be in your favor, but you have to have enough in your body, enough dosages, and have given it repeatedly over a long period of time to see that effect. So by giving one dose of Motrin, even if you do it once a day, at the most twice a day, it's not going to cause symptoms that are going to affect you and to harm you when you are having fever. So I would say that you should go ahead and use Motrin, Tylenol, alternating dosages if you need to. If one medication is not breaking it, you can obviously try ibuprofen or Advil to see if there's any effects with that.
Okay. So when
Okay,
people are, go ahead, I'm sorry. Carry
so
on.
when people are having the fever within 24 hours, you want to do the antipyretics to kind of bring down the temperature if they're not having any other symptoms besides fevers. And the reason why you want to stay out from urgent cares and doctors' offices within the first day of your fever, because most of the time the fever goes away within 24 hours. In fact, if you were to go earlier, maybe your test will come out negative, and most of the time it'll just be a 24-hour bug or a virus that will sort itself out by the time the second day comes along anyway. And in fact, you're exposing yourself to more other illnesses and sicknesses and going to an area, an urgent care or doctor's office that may have other, whether there's strep or whether there is any other respiratory infections around the area, you're exposing yourself more by doing that. So I always tell patients that remain calm. That's the most important thing with what's going on within the first day.
Okay.
Okay. And then once you notice, okay, it's the second day, third day, I'm feeling some fatigue, I'm feeling headaches, I'm feeling sore throat, I'm feeling nausea, vomiting. There's something else more going on than just fevers. Obviously, then you would call your doctor, go to an urgent care, and then eventually get tested for, depending on after the examination is done. If they feel like it's a very simple case, they'll not test you for anything. But if they feel like that you have had exposure, or if you are having symptoms of COVID, they're going to test you for COVID, and they're going to test you for flu as well too, because it's flu season.
Okay. So when the child spikes a fever, are the parents and the siblings around them supposed to be masking up as if this could potentially be COVID
Yes.
in the
So with
head?
the current times that's going on, depending on exposure, if the patient has gone out or has exposure with other individuals who might have had COVID, because COVID could also be asymptomatic. And in pediatrics, that's what I've generally seen, that
Right.
there's a lot of COVID positive that are asymptomatic. So you wouldn't even know that they have it. So if you are prohibiting symptoms, you do want to isolate yourself unless either the fevers and the symptoms are gone, or you've gotten tested and you know for sure that this is not related to COVID or flu or anything of that sort.
Okay. And that's really hard for parents to do. If you have a child who's exhibiting these symptoms, you want to like cuddle them and be there for them and
Oh
you know,
yeah.
give them
Oh
lots
yeah.
of stuff.
And if they're 3-year-old, 4-year-old, you can't leave them alone in a room and say bye. You have to definitely, if you're a mom or dad, you're going to have to be with them. And eventually, you know, that transmission is going to happen if they're at that age. It's very different than when you're a teenager. With
Right.
teenagers, you can kind of isolate them, but with younger kids, that's not possible.
Okay. So should parents just resolve themselves to the fact that, listen, I'm going to get it, so I may as well just get it now? Is it like a chickenpox party where one person would have the chickenpox way back and then you'd invite your friends over just so everyone gets it? And I know that that is like COVID is not to be compared to the chickenpox by any means, but I mean, I'm in a household with with some COVID here and I'm just like, well, maybe I should just get it now. Why am I bothering? But
Yeah. So, I mean, it depends on whether you have secondary other medical history or other conditions that, you know, if you were to have some other medical conditions, you obviously want to be as careful as possible. If you can reduce the rate of transmission by keeping yourself isolated, and keeping keeping the mask on, washing hands, keeping distance, you know, that also would be fine too. It all depends on your medical history. And as far as wanting to get the virus, I think a lot of us are trying to prevent from getting the virus, initially, because you don't want, you're not sure, we're not sure what effects it may have on your body, whether you'll have more of an inflammatory effect versus some kids may not have an inflammatory effect. So
right.
it's variable individual per individual. And I
Okay.
do have, we do know somebody that, you know, the whole family was affected with COVID, but that particular mother was the only one who ended up hospitalized and is currently, you know, intubated. So just because everybody has had COVID in the household, they're all pretty much asymptomatic, maybe at the most runny nose, doesn't mean that you are not going to, you know, have symptoms that would be severe or in a different form than your other family
Okay.
members.
So those words of caution are actually resonating very, very loudly in me, and I will
Oh
stay
yeah.
strong.
Yes, absolutely. Absolutely. So if you be as careful as possible, wash your hands. And, you know, being older, you've been exposed to coronavirus in different forms. It also depends on your immunity as well, too. So, and what we talked about in the last video, also just a touch of it, is making sure you keep your immune system high with decreasing your stress hormone or your cortisol levels, taking your vitamins, eating as much fresh food as possible, getting as much fresh air as possible. Yes. That's it. That's my girl right there.
Let's talk about vitamins for a second here, because
Yeah.
this has like been the regimen for a little while. So we have the elderberry, we have the vitamin C, we have zinc, and we have vitamin D.
That's it. And that's it. That's the most important vitamins that we're discussing. You know, you hear about it on the news, you're hearing about it documented in a lot of literature and articles, that how effective it's been shown for patients' immune system and therefore helpful in warding off viruses, not just this virus, but other viruses as well too. And other people, you know, sometimes are taking like those zinc lozenges, so that way, you know, they can ward it off. We've known that in the past as well too, but now people are taking capsules to have a little bit more stronger effect,
Right.
a better effect, a higher dosage of it, so that way it's more effective for us.
Higher
So
dosage. Can people overdo it? Like if you're talking to kids, my son who's 20 is going to take a different dose than one of your 5-year-old patients.
yeah.
So what's the proper dose for these things?
Yes. So with kids dosing and adult dosing and teens being very similar to adults, the dosing is written on all the bottles as far as which one you can take age-based and which one's okay for a particular adult dose or weight-based.
Okay.
So
Don't
it's
overdo it
very,
then.
very hard to get that confused if you're reading your labels on your bottles and your vitamins, which you should be, to make
Okay.
sure
And
that
which of these are you at risk if you overdo it? Is it the vitamin D or?
yeah, so I mean, vitamin C, if you overdo it, can cause issues with your blood vessels. So that's something that you want to be careful with. You don't want to do too much of any vitamin because, you have to keep a fine balance in your body and keep a balance in your body. So ideally, vitamin C, you want to keep it for adults under 1,000 milligrams, and I wouldn't go over that.
Okay. Good to know.
Okay.
Okay, so here's a couple scenarios. Your
Yeah.
kid starts running a fever, they have some symptoms. You said let it play out, let the fever
Yeah.
play out. But
Yes.
as a parent, I feel the need to go get the kid tested or get
Yes.
myself tested as well. So at what point, maybe after the fever breaks, do I go get the kid tested at an
Yeah.
urgent care, or do I
Yeah.
come to the pediatrician?
So you can go to either or. Some pediatricians are carrying the COVID swabs, and some of them are not because they just don't feel comfortable doing the swabs or doing the testing in their office because they're seeing a lot of infants and whatnot. So they want to keep that separate. Now we are doing testing. We're doing the RT-PCR testing, which is the nasal pharyngeal swab. It goes all the way back down your nose, touches your throat. So a lot of patients do not like that one, but it's the most sensitive one, the most accurate one, and that does come back in about 2 to 3 days
Okay.
after we do swab you. We have patients mostly do it outside in the car. So we come to your car and we would do it at that way. We would suit up to go there to get it done for you, or we have you come into a side room where you come separately and you're not coming through the main office area. So if some pediatricians do have it, that would be great because it's a comfortable environment. You know that environment. So it's always preferable for a lot of families to go to them. If you do go to urgent cares, a lot of them are setting appointments. They are a little backed up because the amount of people making those appointments. So you may not get it on the same day. You may get it a second or the third day. So that's something you have to be mindful of. Sometimes when you go too early, your test could be false negative. So you may not have enough of that virus in you for it to turn positive.
Yes.
And that,
My daughter was exposed on Friday. She got tested on Sunday before symptoms after learning that there was a positive at the party,
yes,
not the
yes,
party, but the gathering.
yes,
And she got tested too early, came up
yeah,
negative, had
yeah.
symptoms that night, then got tested 2 days after that, and then
And
tested
so it's
positive.
positive. So that's what I tell parents, that's why it's not worth it to come rushing in the first day of that fever or
Right.
the symptoms. Try to wait if you can, if there's nothing else going on within the end of the second or third day, because at least there'll be a little bit more accuracy and a little bit more of that viral load.
Right, but then
Um,
you do have to wait the 2 to 3 days where actually the emergency cares and urgent cares are calling it 5 to 7 days actually till your test turns around. So
yes,
during that entire time,
yeah,
you got to
you have to be
quarantine. You
quarantined.
have to treat it
Absolutely.
like it's COVID.
Absolutely. So I understand, a lot of people's frustration. You go too early, it's negative. You wait a couple days for that result. You go again after a couple days, you're still going to have to wait a couple days for that result. In the end, find a midway point where you can go. You're going to wait 2, 3 days for that result. But yes, you have to stay quarantined during that whole entire time.
Yeah.
Um, just to protect everyone in the household, depending on who's in the household. Of course, it's affecting people over 60 a little bit more, severely than it is people at other particular ages. But again, it depends on your medical history.
Okay. Now, if you have two positives in the house and one negative, can the two positives frolic together?
Yeah,
Really?
absolutely. So, yeah, so if there's two
Okay.
positive of the same strain, then you have the same exact virus that you've probably interchanged yourself anyway. So there's no reason for you to separate yourself from
And now
them.
the same
You know,
strain, does that mean the same symptoms are being?
same, because COVID-19 is the strain that you're having. So
Oh,
that's the
okay.
same virus strain that you're having. Why wouldn't you stay together? Your symptoms are not going to get worse by being together in the same room with the person who has the same exact strain as you.
Okay. Now
Yeah.
there are rapid tests available. One is a molecular and one is an antigen. Are these rapid tests something that people should be investigating just for a quicker 20-minute answer? Are they accurate? And then
Yeah,
what's
so
the
the
difference between
accuracy,
molecular
the
and
gold
antigen?
standard is the nasopharyngeal. So the RT-PCR one that we talked about that goes down the back of your nose is it's the gold standard one. The rapid one is not so sensitive. That's checking for the antigen testing. It comes back within 15, 20 minutes. But some offices, some businesses are using this, just to get answers right away, whether they don't have that allowance of having 2 to 3 days to
Right.
eliminate an employee, or to know whether they have to have them there or not have them there. So it depends on your situation, what you find. But if you want to get the best results, it's the PCR testing is the best
Okay.
one.
They did tell us that the rapid testing was 97 or 99, maybe 97% accurate. So, I
Yeah.
mean, I don't know.
Yeah, so I think there's a lot of, again, false negatives more than the gold standard, the PCR testing. So that's something that I would compare those numbers. But from
Okay.
my reading, the antigen testing is less sensitive than the PCR testing.
Okay.
There's also a newer testing, or not newer, but it's been out for a few months, but one that's not employed so much by the urgent cares and the pediatric offices, is a saliva testing. So that's something that, you can even order online, or you can get done at some centers. It's not available at all centers. Yale had come out with this, and also Rutgers is getting labs that are getting these tests, and they're getting them reported that way as well too. So that's another test that's shown pretty good accuracy, pretty comparable to the PCR testing. Only thing is, with the cost of it, there some centers or some places, they're much more expensive. So if you were to buy it online, it's $100 and some to buy it online, and then there's a waiting time of about 24 to 48 hours to get those results back. So it depends
Okay.
on what you're looking for. But the nasopharyngeal and the antigen testing, the rapid, is what's available in most urgent cares and pediatric offices. But you could also go to pharmacies. So there's a lot of drive-through pharmacies that are also having these tests available. So you have, different options there for testing, which was not there earlier part of this year.
Okay. And I know that you mentioned that, don't go so quick to get tested, but should they eventually get tested in order to be counted? I know that the schools are looking for documentation. I know that the CDC, of course, is looking for proof of how many people have it or don't. And then the
Yeah.
other part of that question is, after they're tested at urgent care, and if they do come up positive, is that something that you're basically asking your patients, hey, let me know, give me a heads up, send me a copy
Yes.
of your report? Because
Yes.
I reached out to our primary care physician, and they were like, well, you could send the report if you want or not.
Yeah.
And I was like, don't you care?
So we automatically get the urgent cares sending us, if they're really good, they send us automatically the results. So every single one of our patients that's going to the local urgent care, which is the only one I recommend for the kids in the area that we're at, those reports are always sent to us.
How did they
But
even know? Because they don't ask the primary care physician on the forms. It's interesting.
So, so in that pediatric facility, they do. So
Okay.
in that urgent care, they are asking, who's your pediatrician? So they want us to be in the same loop as well too, in case they were in the office recently, in case they had a sibling who was in the office. Then that's the way we're going to trace that. Okay, there was exposure. We have to kind of track back a little bit, and make sure that that's exactly. And then I document it in the chart as well too, that that's what happened. But
Yeah, that's
it
good.
depends on the relationship with the pediatrician that you have, of how much you stay in contact with them. But when we educate them, we always tell them, if there's any reason that you're going to an ER, you're going to an urgent care, please let us know for what you're going, because that's something we do want to document in their chart.
Okay, excellent.
Yeah.
There's a
Yeah.
couple of other questions. I know that your time is short here. What are the comorbidities or underlying conditions of kids that parents should just be a little bit more cautious of if they have kids that have these conditions?
So like I mentioned, there's milder cases, which is what we've been seeing in pediatrics. With the cases that have been positive, at the most, we've just been seeing fevers and asymptomatic kids. But if a child were to have other medical conditions like asthma or reactive airway disease or a heart condition or a kidney condition, you want to make sure, that you get that evaluated and you're in touch with that specialist, which is something we would discuss, obviously.
Okay. Or
So
diabetic.
asthma exacerbations is what you could see, and for that reason, pneumonia, a lot of inflammation. A lot of it is more respiratory related conditions that for patients that we would worry about. But anybody with medical conditions like diabetes, asthma, kidney conditions, lung conditions, heart conditions, those are the patients that we are a little worried about, to make sure that we get them tested earlier, and we make sure that they're in touch with their specialist as well too.
Okay. And then there was the vaccine that was approved today for use in and distribution in the UK. And I think that we're waiting here in the United States for that to happen as well. And it should be happening shortly. And I think the states are going to be the ones that decide who and how the vaccine gets distributed and to whom. They're planning on starting with the healthcare workers and the older population, and healthcare workers mainly in hospitals. But talk to me about the vaccine. Yes, and nursing homes. Yes. Your comfort level with it. Again, I know we talked about it before, and it hasn't really been fully tested on kids as much as we'd like. But as a health
So the healthcare workers are the first line of patient population that they would like to get these vaccines out to, especially the ones in the hospital that are, ICUs that are seeing really high incidences of COVID cases with high exposures. And then, of course, nursing homes because of all the seniors and all that. As far as comfort of the vaccine, it's been shown, or at least documented, that it's 95% effective, close to 95% effective. And they've done trials comparing placebo versus patients who have gotten the vaccine to document this, and they really didn't mention any side effects yet. But if you compare other vaccines that we've had in the past, which took sometimes 3, sometimes 4 years to come out, versus these vaccines have rolled out very quickly in a matter of months. And different companies like Pfizer, who is the one you were talking about in UK, who's going to start distributing their vaccines, versus other companies that are traveling across the country to make sure that if FDA approval does happen, that they have those vaccines available in different parts of the states to distribute them to places, or frontline workers and senior citizens, obviously, to get that going. It's a personal choice. I'm not sure if they're going to make it mandated at hospitals for all employees to be getting this vaccine. Same thing with at nursing homes. So that's some news that I have not heard yet, as I'm sure you haven't either. My comfort level, because I also have pretty moderate asthma, and I have issues with allergies as well too. I'm not sure if I would feel comfortable actually getting the vaccine so soon. Even though there's studies, yes, they've tested so many 30,000 patients and it's shown 95% effectiveness. But I just feel like it hasn't been tested for that long, and we are not sure of the long-term effects, if any, on these vaccines. So for me, I'm a little bit more skeptical than other medical professionals. So that's my take on it, which is very different. I know Dr. Fauci has very different opinions on this as well too. When you hear him talking about it, he's all for getting the frontline workers and the senior citizens these vaccines as quick as possible now, so that way we stay protected, and that way we're available and we're still intact to treat all the patients that for the winter time that are going to get affected. And then for the other patient population, for it to be distributed around April is when they're expecting it to happen.
Right. And it's going to be 2 doses and they're a month in between each other. And it takes another 5 weeks for the antibodies to, fully
Yes.
bake.
Yes. Yes.
Whatever.
So for me, I mean, I would definitely, not that I don't trust, the companies that are making these vaccines. I just, with my condition, I just want to make sure that the effects of it are nothing extreme for patients who have reactive airway or moderate to severe asthma. It doesn't have any effects that are on the negative side.
Yeah.
And that's what I'm a little skeptical about.
Have you had any patients that got it early and are continuing to have interesting effects from having COVID?
Not
So
in
far?
pediatric patients. That I've had all the pediatric patients that have had it earlier or in the summertime, none of them have had any long-term effects or any interesting effects. They pretty much came back to baseline within 2 to 3 weeks.
Okay.
So not in the pediatric population, maybe with internal medicine or adult doctors, they've seen different things. From family members and friends, we've had knowledge of patients being, like I said, some families being completely asymptomatic, but then one turns out to go to the hospital, has pneumonia, and is ventilated, and then they still end up on oxygen months later, even after coming off the ventilator. So we do hear patients like that. That same patient also had blindness in one eye because of the effects of the virus or the ventilation or the deoxygenation, whatever it may be. So at the extreme, I've heard of those situations or those cases, but not in pediatrics.
Okay. Have you had to prescribe any drugs like remdesivir or anything for any of your patients?
No, I've not prescribed any medications except basically just the antipyretics, fluids, almost the basic care for viruses. And the vitamins, we've been talking about that. A lot of food changes in their diet. We've been talking about activity level, what to do.
What kind of food changes?
A lot of the
For
food changes that
COVID,
we've
COVID
discussed
diet.
for when patients have COVID or any viruses, or even if they were to have the flu, I always tell them come off of dairy. Dairy is very you could say inflammatory or mucus producing. So when you reduce the cow milk intake, you reduce it in yogurts, cheeses, they're obviously less mucus production, less inflammation. There's definitely positive effects in patients. The second thing is have more cooked, steamed, or foods with soups that you can make into soups, which is really good for you. Garlic, ginger, those are also very good things that you can put into your food that are helpful. Ginger is known to be an anti-inflammatory as well too, so I have it in my tea on a regular basis. So that's something really good for patients over 1 who can have honey. Honey or manuka honey is very good. It's very helpful. That helps for excess mucus production. So those kinds of changes is what we kind of talk about.
Okay.
Mhm.
What about daily activity? We heard that you really shouldn't treat this like a go upstairs in your bedroom and rest kind of thing. COVID
Yeah.
should be stay as active as your body will be able to
Allow
handle.
it. Absolutely. So you should be moving your body as much as you can allow it, because you want your lymphatics to flow. You want that cycle in your lymphatic to be moving. And the only way that's going to be happening if you're up and out and you're making your body sweat a little bit, or you're doing some activity. And that's always been something that's good to do on a daily basis, not just when you have COVID or when you have other viruses.
Okay.
The same thing goes for mindfulness. And a lot of it is something that our mind is telling us, or a lot of the anxieties that's telling us, and it kind of makes our symptoms worse. So if you do things like visualization, meditation, you do breathing exercises, they're really helpful for any sort of sinus issues that you're having. They're really helpful for increasing your lung capacity. And that's something good to implement on a regular basis.
Every time someone talks about breathing, I have to
Make sure.
Do it real quick. I'm like, am I even breathing? Even before you mentioned breathing. Okay.
And there's several breathing exercises, and I'm sure, at some point we could always talk about that one can do to help not only increase your lymphatic flow, but to also help prevent patients who have allergies, sinuses, asthma, lots of postnasal drip. If you were to do a series of these breathing exercises, they're very helpful in your morning routine. Not only for that, but to bring down your cortisol level, because a lot of inflammation in your body happens from high cortisol and anxiety related issues. So that would also be, you want to reduce your coffee or your tea intake, because again, you're increasing your cortisol.
Nope.
and you could do decaf for a day or two.
I only drink like 1 or 2 cups a day of
So
coffee.
that's not bad. That's not bad at all. Some people are drinking, several cups, 3-4 cups. So obviously you want to keep it in limit.
Yeah, definitely. And if you were to give like a quick breathing, is it 10 seconds in, 10 seconds out slowly, or anything?
Yeah. So I always do 4 and 8. So 4 seconds in from your nose till you completely fill your lungs. You hold your breath for as many seconds as you can, and you breathe out for 8. And you breathe out for 8 seconds.
That's
And
good.
that
Better
really,
already.
yeah, really calms you down. And which, like I said, a lot of it is just sometimes our inner anxieties that, we cough, we sneeze, and we're thinking we have COVID. So a lot of the times, if we just keep our mind a little bit more still, mindful, and do these things, that's all you need. That's all you need to stay healthy.
That's good. What about hot showers, cold showers, going from hot to cold, heat shock proteins, all of that stuff to like get things pumping in your
Yes.
body?
Yeah, so different literature has different opinions on this, but if you look at more Eastern medicine, a lot of them do talk about doing, a hot shower, but then changing it over to a cold shower for, a couple of seconds just to get that, again, the same idea, your lymphatics moving. And that is really helpful for the same purpose. There's some, baths that people take and they go to retreats of that nature where they're in a hot tub and then they get shocked with some cold water right after that. The whole idea is exactly the same, that you're just improving your circulation and your lymphatic flow, which also could be achieved if you just do, jump rope, or you do some sort of little bit of exercise in the house just to get your body moving a little bit. So the same effect could be from that too.
Yeah, and your lymphatic system are the ones that are fighting all the bad
The
stuff that's in your
infections
body.
and the viruses, those are the ones that send all the blood cells, the white blood cells, to attack the site that's really affecting you. So you have to keep your lymphatic primed. And so a lot of it should be discussion on that. Versus, okay, what are we going to do management wise? What's going to happen in other situations? I think there's a lot of talk on the vaccine on the news, which is great, but there's not much talk on the news or many other forums about how are you going to prevent this, but how are you going to keep this as a lifestyle change just to keep yourself healthier? So you may not need medications. You may even come off of certain medications if you keep your diet, helpful. If certain food allergies trigger you, how do you figure that out? Just to make sure that's not triggering and causing more inflammation in your body.
Right.
So,
And if you get it, how to rev up your immune system for fighting
yeah,
it quickly and
yeah,
efficiently. So yeah, eat
yeah,
well, keep moving, be
yes,
mindful,
yes,
hot water, cold water, breathe.
breathe. Exactly. And a lot of it,
Short list, you could keep it on the refrigerator.
yeah, yes. And sometimes if you just start off your day that way, it really sets the tone for the rest of the day. It really
Right.
makes a big difference. And, one thing I have been seeing, all the kids are inside now again because the schools are once again turning more virtual. And so the kids are not moving so much. So when I'm doing well-check interviews, a lot of them have gained a lot of weight. A lot of them, their sports have been canceled, but they're still not doing any activity. A lot of them
Mhm.
are just sitting there doing their work. And I think it just has to be maybe a regular family thing that for 30 minutes we're going to go out, or for 30 minutes we're going to do some sort of activity in the house together. And, that would make things much more interesting, but also helpful for their bodies as well, too.
Yeah, definitely. You could be launching yourself into a comorbidity
Yeah.
if you don't play your cards right inside.
Yeah. Yeah.
People that do have COVID, are they allowed to go out and take a walk?
Absolutely. You can
Okay.
definitely go out, take a walk, but some parks, before entering certain parks, I know I went on a hiking trail, they recommend wearing a mask because there are several other people that are also walking the same trail. So in case we can't keep that 6 feet distance, they would appreciate that you keep your mask on. But if you're just walking outside, you're in your complex, there's not many people around during the daytime,
Okay.
it's good. Let yourself breathe without the mask and
Yeah.
go out for a walk.
And is it good to open the windows in the house and let the air circulate throughout your own household? I went to open up a window near one of my COVIDs in the house,
Yeah.
and they were like, "No, but it's cold." I'm like,
Yeah.
"No, we
Yeah.
need
It's
new
good.
air."
You need new air. You have to keep the
Yeah.
circulation in the house going. So for the other old air to empty, you need to open up the air and get that cross ventilation going. So it's very important. Yeah. Yeah.
Excellent. Well, we will do
Yeah.
that. So, yes, let symptoms ride out. Go
Yes.
get tested just to be counted eventually. Stay calm. Handle it like it is just a regular virus, unless you see something crazy going on. And
Yes.
yeah, thank you.
You're welcome. So hopefully that's helpful for some patients, and hopefully that, decreases a lot of calls that they're making to the doctors, a lot of questions that they're having.
Yeah,
And
I think the whole
that would
thing
be
with
great.
just when to get tested, what if you
Yes.
test positive? They're not giving you any information when you leave the door. There's no form that they hand you that
Yeah.
says, stay moving, eat
Yeah.
right,
No.
reduce your this,
Yeah.
call if emergency. Like, how do you know what becomes an emergency?
Right.
Chest
Right.
tightness, is that an emergency? What to do
Yeah.
for that? There's
Yeah.
no follow-up. And plus you have to wait like 5 to 7 days now in the urgent cares. And I think people are just lost for those 5 to
Yes.
7 days.
Yes.
Should they wear a mask? Should they not wear a mask? Should they eat dinner with us?
Yeah. Yeah.
All those questions. But I think hopefully we've answered them here.
Yes. Hopefully.
Yeah, hopefully. But if anyone has any questions, of course, post your questions or contact one of us. Okay, we're back again on One Take with Jess. This is like part 2, because after I stopped recording, we started talking about a whole lot of things that are really important. So one thing that we talked about was blood oxygen levels, and making sure that if you have chest tightness, that your blood oxygen levels are good. If you have an O2 meter, the technical word for it is a what?
Pulse oximeter.
Pulse oximeter. I call it my oximeter.
Oh, whatever works.
Yeah, so make sure your oxygen levels are up there. Anything over 96, you said was good. Anything below 92, you should get a medical attention immediately. We talked about if you lose your insurance. Do you want to mention a couple, like families right now are currently losing their insurance?
Yeah, so absolutely.
Options.
There's a lot of people because of the economy that have lost their jobs. And so a lot of patients are losing their insurance for that reason. But one thing to mention, so everybody is aware that, even if you were not to have insurance, there's some urgent cares, there's some pharmacies that can accommodate that and do, the free swabs for that, for those individuals. And the same thing in the ER, obviously, if you don't have insurance, they're still mandated to treat you. So
Yes.
don't feel that you're going to be, stuck with the huge bill. Your health is the most important thing. So make sure you seek attention and get help as soon as possible. And it's never wrong to ask. It's never wrong to call and ask that. This is my current situation. Where can I go? What can I do?
Right. Excellent. We also talked about what was the other thing that we talked about? Hospitals, insurance,
Isolation.
isolation, like
Yes.
strict isolation. If you do have a
Yes.
COVID positive person that is
Yes. So if
roaming
there's a
around the
COVID,
house.
absolutely. If there's a positive COVID case in your household, whether it's the husband or child, you want to make sure they're isolated in a separate room, bedroom, basement. And you want to provide them care, obviously, by bringing things to them so they're not roaming around the room, they're not touching doorknobs, they're not touching things in the kitchen. Otherwise that's exposure to other family members who do not have the virus. And that's something that's very important, that to decrease the transmission between family member to family member.
Yes, we mentioned the aerosol as well as anything that might be on surfaces. You said use rubber gloves, of course, Lysol spray or whatever. But the fact that if they are roaming about, they are breathing and the air just kind of lingers there, and their viral load may not have been so much a day or two ago where you sent them out the door to go get tested, but the viral load could have increased since then, especially when symptoms are being exhibited.
Absolutely. So for that reason, just because on day one, they weren't having any symptoms, or even if they're asymptomatic, they're positive, as it goes to day 3 to day 5, your viral load is going to be the highest. And that's when you really have to be careful to stay away from family members who don't have this virus. God forbid they have any sort of reaction or inflammation to this virus that is in the extreme than what you are, that's going to make a really big difference in their health. So you want to try your best to stay isolated and keep that person isolated and provide them whatever care that they would need while they're quarantined.
And you also mentioned that if you've had COVID, you can possibly get COVID again.
Yeah,
so you're not a superhero.
No. So with any virus, just because a lot of patients assume I've gotten COVID, I shouldn't, I just had it, or I had the flu, I shouldn't get it the rest of the season. We've had situations where patients have gotten the flu and then a month later they had the flu again because they had that exposure again. Very similarly, COVID is also a virus with the similar sort of incidents that can happen. So you have to be careful. Even if you've had COVID, doesn't make you, just like you said, with superpowers that you're going to avoid this virus completely. You could still get exposed to it. You could still have symptoms from it. Maybe it may be a bit milder than it was before, but you could still have positive case, right after you've had one a month later, in fact.
That's crazy. And if you're quarantining, how it went from 14 days down to 10 days down to 7 days, but is it from the moment you were exposed or from the moment that you showed symptoms, from the last day you showed symptoms? Like, again, that's all across the board.
Yeah, so I would go with the first day of your symptoms, because you may have had symptoms, and that's basically when you can also have transmission too, is when you're starting to have symptoms and you want to quarantine at least for 14 days.
Okay.
From the date of your symptoms, because you don't know when your test result's going to come back positive. You don't want to wait for that day. You want to wait for when your symptoms have started.
Okay. So from the day your symptoms have started, 14 days,
right.
Even though they're calling it 10 days and 7 days now, if you can do the duration of the 14, that's probably the most.
Right. Because we're going earlier. We're doing it in the beginning where you started symptoms. So for that reason, waiting 14 days, it kind of would be kind of equivocal. Waiting about that much, and always a little bit more is always better than lesser amount of days for quarantining, for making sure that the virus is completely out of your system.
Okay. Well, yeah, I'm glad I caught this last bit on tape. Yeah. Now I'm starting to cough. Oh, dear Lord. Okay. All is well. All's well. I'm going to go out for a nice brisk walk. Take the dog for a walk. Get my lymphatic system moving.
I'm so proud of you.
Thank you. Okay. Thank you again for being on.
You're welcome. No problem. Hopefully that's helpful. Hopefully we got some people watching it and then they find this helpful for them.
Yeah. And if something is wrong, go get medical attention. Like if something is wrong, if there's tightness in the chest, if there's any breathing issues, that's when don't wait that out.
No, because Decadron and azithromycin to some extent, and other things of that nature have been shown to be helpful.
So this is early intervention antibiotics to prevent any pneumonias or bacterial
along with if you need a steroid. So,
And
and that's
start.
something that they can provide you right away. So you don't go to the point of being on the third and fourth day and having heavy tightness and heavy inflammation.
Because
Some
like you
people are,
said before, there's lung damage that
there
starts
is,
to occur.
yeah.
So,
So if there's areas of deoxygenation in parts of your lung, how are you going to reoxygenate that later? You're not. It's going to be very difficult for that to recuperate after that. So it's
right.
always better to go as soon as you're exhibiting symptoms, because at least you can get this. And honestly, sometimes it's a peace of mind. So because I have moderate asthma, I always have these things. I had a fresh Z-Pack and I had prednisone sitting around, and it just gives you that peace of mind that if I were to have those symptoms, I have it on hand and I can start it right away. So it
Okay.
helps you in that way too.
That's good. I mean, we have
Yeah.
like albuterol here. Is that something
Yeah.
that I would think about if, God forbid, symptoms of, respiratory distress?
Chest tightness. Yeah. So if you're having chest tightness and you're feeling that you're not able to take a full breath in, you could definitely take the inhaler to see, because it's a beta agonist, which opens up the airways. So it does help. But if you're still, even after that, still having symptoms, then that's something that you could do a teledoc. I mean, that's what I was telling a lot of my friends, is that you don't have to actually go to the doctor. Now they're doing a lot of telemedicine, and they can provide you medications based on your history right over the phone, which is in the comfort of your home. So why wouldn't you?
Yeah, definitely. And
Yeah.
aside from the medications that open up the airways and reduce inflammation and treat infection, can the teledoc actually provide you a prescription for oxygen if you need to supplement with oxygen?
If that would be the case, they would want you to come into the office and they would check your pulse oximeter, make sure it's accurate what you were checking at home, and then depending on that, see where they're going to direct you. But likely not to give you oxygen at home.
Okay.
Yeah. But if you feel like you need that, then that's what you have to call 911 for. They would come right away. They would check your oxygen to verify that, and they provide you oxygen. They also have Decadron that the EMTs and the ambulances are carrying now in case they're having chest tightness, because a lot of patients have been exhibiting this.
Okay. Is it better to call an ambulance or just to go into the emergency room with a family member taking you?
It depends on how severe your symptoms are. If you feel like you're feeling dizzy and you can't make it to the ER, you want to call the ambulance,
Okay.
because obviously they'll come within, 5-10 minutes. They'll check your oxygen to make sure that it really is, the oxygen is going down, or is it your anxiety that's flaring up? And then, and then they go from there. And they have oxygen available with them if they need to. They have the Decadron with them if they need to. They have the albuterol or the nebulization if they need to. They have everything. So worst come to worst, you can always call 911 and that would be provided if you're not able to make it to an urgent care or to an ER. But hopefully we don't even get to that point, because like I was saying, telemedicine is now available, and a lot of the physicians are available to prescribe medications depending on your history and depending on your symptoms.
Yep. Yep. Thank you again. And you know what? One last message, and I guess this is to all the parents that I'm sure you would agree with. Don't put off your own health, and go get your mammogram screenings and go get your, other prostate exams, whatever it is that you need to get checked, because you are the ones that are caring for these kids. So I would assume you need to keep yourself in tip-top shape
Yeah.
in order to do so.
Yep, that's very important. Sometimes we put our health last after the kids, but it's kind of like that airplane theory. You have to put the oxygen on you before you help anyone else. So it's very important to take care of yourself.
Yes. I got to go get the girls checked. Oh, it's all good. So yeah, thank you. And I didn't want to end on like those extreme notes, but you were mentioning a little side story of how someone did wait too long, and as an adult. So now, she's in a little bit of a health predicament that we are hoping and praying that she pulls out of. So
Yes.
our thoughts
And
are with you guys.
thank you. Thank you. Thoughts and prayers are with that family. Absolutely. And hopefully this helps people realize that there's so many forms of help out there. You don't need to wait days and days before you seek that. You have symptoms, go seek help. You know, the worst that's going to happen is they tell you your lungs are fine, your oxygen's fine, nothing's going on, you're good. If anything, you get some mental peace with that.
Yeah, that's true. And even though in the beginning we say, if there's a little fever, it's okay, let it ride and act as if it's just a regular this. But yeah, if you're feeling something's definitely not right, then definitely don't wait to seek help or make a phone call.
Right.
For sure.
Absolutely.
Okie doke. This is for real.
Okay.
Thank you very much.
You're welcome. You're welcome. My pleasure. I loved being with you. Always love your questions and the intrigue and the detailed, sort of, the discussion that we have. I love it.
Well, thank you. Thank you for humoring me and answering all my questions, whack questions. But yeah, you're a super smart gal and an excellent doctor. So thank you for doing all that you do.
Thank you.
All right. Take care.
Bye. Bye.
Bye.